welcome back to my channel. If you're new here, hi, my name is Shawna. If you're not new, thank you for coming back. Happy New Year! Oh my god, it's 2024. I don't even know when was the last time that I filmed a video in 2023. It's been a while, and I just want to say life has been a lot, school has been a lot, and I've just had things that are of higher priority than YouTube was for a while. I kind of lost inspiration for a good while there and just wasn't really feeling the vibe. There's a video explaining this coming soon, but for the new year, I am currently home. I'm trying to knock out like a bunch of videos and have them edited and uploaded so I can be up to date at least for a while, just keep some content going. As of today, I'm filming 11 videos today, so I'm gonna schedule them all. So for the next 11 weeks, there will be content coming. Fingers crossed that I get them all edited before I leave, which I think I can do. So there will be content coming, at least for the next 11 weeks. After that, I can't promise you, but I will try. So as you can already tell from the title of this video, we're gonna talk about what you do in third year. This video has been months coming, like months. I was supposed to film this video for so long, but better late than never. So let's get into it now. Third year is basically the first year that you are immersed into the hospital. No longer are you doing classes in just like a regular classroom where you're sitting down and your biggest worry is what topic is going to come on exam. This is the first time where you're actually doing practicals like every day, and it's not at all what you expect. It's terrifying also because yes, there are subjects within the course where you go to the consultorio and you stand up and observe the doctor seeing patients, but it's nothing like what it's like to be immersed in third year and be immersed in the hospital. It's definitely a lot of new information being thrown at you a lot at one time. I feel like first and second year, yes, they're hard, but third year was just a whole bunch of expectations that you didn't really see coming. It was expected that you knew this, it's expected that you knew that. Like first and second year, you're studying to basically learn information so that you can vomit it back on to the exam paper. Third year, doctors are expecting you to actually know this information, and you might have been the person that's like swatting just for passing exams. No shade, that person is and was me. If you are in first and second year right now, or you're about to start third year, I'd advise not doing that. Revise first and second year things if you can, especially physiology. They like to ask a lot about that, so we're just gonna jump into the different courses that you do within third year and what they entail. I'm just gonna break them down. If you haven't already watched what you do in first and second year and you're interested student, I will have them linked in the tab. They should pop down right now, and let's get into it. So broken down by semesters. First semester, the most important subject that you will do in first semester is propedeutica. What is propedeutica? It's basically an introduction to symptoms and syndromes. So you're basically going to learn to classify the different syndromes that a person may possess and the symptoms that fall under those syndromes. So one of the first things, the primary things that you're supposed to know is that symptoms are basically what the patient describes is happening to them. So whatever the patient describes to you, like, oh, my head hurts, I feel nauseous, like I have fainting spells, those are symptoms. Syndromes or syndromes are what the doctor observes within the patient. So that's a major thing that you need to know, the difference between those two before you start third year, so that it can help when you're in third year, because that's like the first thing that they teach you. Next thing under propedeutica, for your schedule. Depending on the school that you attend, propedeutica is usually like 3 days out of the week. So when I was in third year, we had a propedeutica 3 days out of the week. So you only had to go up to the sala, which would mean you're on the ward 3 days out of the week. And then, so it would be Monday to Wednesday, or it could be Wednesday to Friday, depending on like however your schedule is set up. Remember, you don't get to pick your schedule is dictated based on the group that you're put in. So it's 3 days out of the week. Within those 3 days, you're in the sala, you're on the ward. You have to reach there between 8 and 8:30. Usually the doctor will take attendance. You're supposed to go straight to your bed. that will be assigned to you on your first day. If you have a patient there, then you're supposed to like basically check on your patient, make sure that they're okay, take their vitals for the day, and then you're going to do the morning write-up. So at 8 o'clock, basically, or 9 o'clock, you're supposed to write up an evolution, which is basically, I don't really know what you call it in English, but essentially you're supposed to check your patient and write up like your findings. So did they sleep through the night? Have they been defecating and urinating without any problems, or did they have constipation? Have they been eating? How do they feel? Do they feel high in energy? Do they feel weak? Are they having any abdominal pains? Are they having any headaches? Are they breathing properly? So it's the first time that you're going to learn how to write up an evolution. Very, very, very first time. They also expect that you know or you have historias. You're supposed to have historias. What are historias? Historias are the printouts that the hospital uses to log information for patients. So whether they're new admissions or whatever, or if it's like, whenever there are new admissions, that's when you would write up a historia. So it goes from general information and general systems to the specific systems, whether it be respiratory, cardiac, nervous system, all of that broken down. And you need to know, you're going to learn how to write up all of that. So the evolution that you're going to write up now for your already established patient, if they're not a new ingress or a new admission, is basically after all of that interview that you've done with the patient, you're going to write up, okay, paciente de 38 años de edad or whatever, or a 28-year-old patient that was admitted for whatever reason. They said that they had a good night's sleep, or they slept through the night without any issues. If they have stomach pain, then you would say, oh, they have dolor de estómago, or no, you wouldn't say dolor de estómago, that's so wrong. Dolor del abdomen, so they have pain in their abdomen or wherever. You're gonna learn, but I'm just giving you a breakdown because no one gave me, and we were just kind of thrown into it, and the doctors just kind of expect you to know it and you don't. So basically those things, and then you're going to go, after you do the general like synopsis of their overall being and how they are, that's like a paragraph long, and then the first thing you're going to go into is PLE mucosa. So you're going to talk about their skin and their mucus. Next is tejido subcutáneo. So if they have anything, some call edema, you'll learn what it is. If they have edema, you're going to do the test. You'll write if it's infiltrado or no infiltrado. No infiltrado means they're good. Infiltrado means that they have edema. Then you're going to go down to the respiratory system, write up if they have esthetores. So you should be listening with a stethoscope to hear if you hear any noises while they're breathing in the hemicampo. So you should be listening to hear if you hear anything that's abnormal. So if you hear anything other than normal breathing sounds, you need to make a note of that. Then you're going to go into the cardiac system. You're supposed to listen to their heartbeat, record their cardiac frequency. So how many times per minute did the heart beat? You're supposed to record that. You're supposed to listen to hear if you hear normal heart sounds, or if you hear a soplo, which is a heart condition which is irregular. You need to make note of that. You're going to see all of this in propedeutica because it's literally like general medicine basically. So yeah, moving on. After the sistema cardiaca, you're going to go down to abdomen. You need to check their abdomen. You're supposed to palpate the abdomen. You need to inspect it. Let me go by order. Inspection, palpation, percussion, and then audition. But in the case of abdomen, it would be audition, auscultation. In the case of abdomen, it would be inspection, auscultation, palpation, and then you don't really need to percute. If you don't know what any of these words mean, you will by third year. I'm just giving you a general thing, and you should, because by second year you would have been in like a consultory and they would have shown you like how to. But if not, there's a course in second semester that teaches you about all the things that you're going to learn in third year, or there is an introduction. So you must know the words percute, palpation, all of that. You don't really percute the abdomen, and the reason why you auscultar first is so that you're not disturbing anything that's in their abdomen that could change. So because basically when you touch up the person's belly, let me just make it as simple as I can. When you're touching the person's abdomen, you can cause sounds, or you can agitate different sounds like gases or whatever that's moving around that wouldn't have been there naturally had you just listened first before you did all that. So because you don't want it to be inaccurate, you listen first. After you move on from the abdomen, next is the nervous system. So in the third year, you're checking to see that everything is good. So you're gonna check the sinus and the reflejos. So basically, you need to make sure that the person doesn't have any paralysis. Make sure that they're alert and oriented in time, space, and person, so they understand what you're saying. They understand where they are. They know their family members. Like they're seeing properly. Like nothing is obstructed. You're looking for signs of everything. It could be stroke, it could be paralysis, it could be whatever, anything that's as it relates to the nervous system. You have to check for all of that normally, and they're going to ask you to check it for your final exam more than likely. So it's good to learn it from early. It's about 12 nerves, and you need to be able to check for every single one of them. And that's it. After the nervous system, then you're going to sign that evolution at the bottom of the paper. You need to sign estudiante de tercer año, and then you put your signature below it. Remember, you also need to make sure that you put the name of the person or your patient at the bottom if it's a new page that you added to the book. Don't expect that they're going to have paper to supply for you. They won't. Don't even start. I'm helping you. Just don't even bother questioning them not have it. So if you can, walk with blank papers to have for third year, because you're going to need them to add them to paper, to the folder, the docket that has the patient information. You're gonna need blank paper. Okay. All right, so basically that's propedeutica. I mentioned before that propedeutica, depending on your school, it's 3 days out of the week, or it can be every day out of the week. For myself, when I was at Huron, it was 3. But I knew people who went to Fajardo or other schools like Calixto, and they had propedeutica every single day. I cannot imagine it, because your first month of third year, you're exhausted because you're not used to being at school that long. So I can't imagine having that every day, which you end up doing it every day in Medicina interna. But anyways, for second semester. So on the days where we didn't have propedeutica, we had Pharmaco. We had Imaginologia, we had Lab Clinica, and we had Cruza Proprio. Oh, and we also had Enfermeria. So I'm going to break down what all of those subjects are, as well as Psicologia. Let me start with Psicologia first. By right, you should do Psicologia in second year. When I was in third year, it was post-COVID, so we didn't do it in second year. We ended up having to do it in third year. It is the most ridiculous subject ever. It's so unnecessary, and the doctors are so mean. And they take the subject so freaking seriously, fam. Like, it was a waste of time, but you have to do it, and you have to pass it. You have midterm exam for it, and you have final exam and presentation for it. It is ridiculous, but you'll have to do it. If it didn't already get done in second year, you'll have to do it for third year. It's about an hour long, and the teacher's just talking forever, and it feels like a waste of time, but you just have to do it. More important subjects are Pharmaco. So I have a hate relationship with Pharmaco. Pharmaco is my problem subject. Now, Pharmaco is basically pharmacology. Obviously, if you're going to be a doctor, you need to be able to prescribe drugs. So you need to be familiar with the drugs to know what to give your patient so that you don't kill off your patient, right? That's what the subject is. So basically, you're learning the different groups or the different drug groups, what they're used to treat, and you're learning the different names of the drug groups. This was hard for me, especially Pharmaco 1, because it was a lot of information and a lot of new information being thrown at you, and you have a study. You cannot swap with Pharmaco at all, because a lot of the medications are so similar in names that you have to develop a strategy on how to learn the different medications. Otherwise, it's going to suck for you. because it sucked for me. And Pharmaco 1 was especially hard to me. And to other people, most people say that they find Pharmaco 1 harder than Pharmaco 2. And I definitely agree. The easiest way to learn it is to learn the endings. And this helped a lot for me when I had to do it. When you learn the endings of the different drugs, specific drugs are grouped by different endings. So I can't think of an example right now, but when you learn it that way, it makes it a lot easier, because otherwise, if you just try to swat like a bunch of them and be like, oh, this is that, when you do your exam, everything laid out in front of you, it becomes jumbled. I promise you, every single thing laid out in front of you becomes jumbled. So there's no way for you to remember exactly what drug was this. Oh, immediately you identify this. If they give you a table and they say like, okay, match, or they give you a paragraph and it's like fill in the blank and the keys at the top and you're seeing all of these drugs laid out, they all look the same to you. So it's important that you learn, 1, the endings, 2, what they are used for, so that once you see, especially for the essay question, once you see like, okay, this patient came in and they had nausea or they're having pain, immediately you know that, all right, it's pain, you treat it with an AINS. What's the aids that could be listed there? Like, be able to learn it like that. So learn whatever the condition is, and then the drug that you would use primarily to treat it. So whether it's AINS for pain, or whether it's AINS for pain, or you need the drug for diabetes, or hypertension drugs, the most commonly used ones, I would say to learn it that way. It helps a lot more. However, pharmaco is a very serious subject, and the way how it's so hard, in the sense where it's common that people don't pass pharmaco, you're allowed to carry it over. Like, if you don't pass that subject, you're allowed to carry it with you up until 5th year, I believe. You have up until 5th year to do it. However, if you can avoid carrying it, avoid carrying it, because as someone who ended up having to carry pharmaco 1, when 4th year started, you can't do it over until like you actually start like either 4th year or 5th year. You can't choose to do it in 2nd semester of 3rd year, because you have pharmaco 2 to do then. And I tried and they were like, absolutely no. When you carry it over, don't carry it over if you can, because it conflicts with your 4th year classes. And it's hard for you to go back and forth, because in 4th year, you're going to be at a completely different hospital than you are in 3rd year. And the back and forth for when you have classes, because they expect you to be present for conferences, they expect you to be present for midterms, they expect you to be present for your final exam. And you can't miss out conferences with the excuse of, oh, I have class XYZ, or oh, I don't feel like going, whatever, because attendance is very important to these people. And you will cause yourself to not be able to have right to sit the exam. So if you can avoid carrying it, avoid carrying it. Take it from me. Let's talk about immunology. This. Pay attention to immunology, because I promise you, it seems like one of those dumb waste of time subjects as well. Just because like you're literally in a theater room and or an auditorium, and it's just like shows of you watching different x-rays, and the teacher is telling you like what exists in this x-ray, like what you're seeing, if you're seeing pulmonary tamponade, or if you're seeing like broken whatever or whatever condition. You're just sitting there and looking, and you don't really know what you're supposed to be looking for, because this is new to you, and they're basically just showing you different ones for you to, and telling you what it is. And in reality, that's how you learn how to read x-rays. You just have to see multiple x-rays over and over and over, so that you learn, okay, I know what I'm looking for, I've seen this so many times, this is this. But it's usually at like 4 o'clock, or maybe no, it's usually after like 3 o'clock in the evening, when you're done your classes in the morning, and there's just like this long gap and you don't want to stay for the class, and they don't really care about attendance like that for it. But go. Somebody go. Because when I started Siri here in 4th year, which that's surgery, when I started surgery in 4th year, then my expects that we know for read x-rays, and we could not read nothing. we could not read anything. We couldn't tell them what the difference things were in it. Like, so go to immunology, go make your life easier, and go to immunology and pay attention and study the different x-rays that exist in immunology. The next course that you do in third year first semester is Lab Clinica. What is Lab Clinica? Lab Clinica is also one of those things where you should probably study, but it felt like a waste of time at the time. Lab Clinica is basically the class where you're gonna learn the different lab readings for different tests and what's normal, to be able to identify what's normal in a patient and what's abnormal, so that when lab reports come back, you're able to read it and be like, oh no, this is way more than it's supposed to be. This patient might be diabetic, this patient might have some illness, this patient might have some infection because of whatever is elevated and what's not, where it's supposed to be within the normal range. I feel like in Jamaica it's not really that deep, or outside of Cuba it's not really that deep, because usually when something is sent to the lab, when the lab's report come back, they point out what's abnormal and what's not abnormal. So Lab Clinica is important also because they expect you to know the values. And as somebody who was taking it that seriously and now has to relearn it and teach myself again, just do it from the start so it's easier. Because by the time you reach 6th year and you're doing your internship, all of this information the doctors just expect, so nobody not teaching them, just expect, and now you are the doctor that is seeing people, and so that you don't kill off people, please learn and go to Lab Clinica. The next subject that you do in third year first semester is Enfermeria. Enfermeria is nursing, basically. This class is more of a practical class. You have it once a week, it was, I believe, yeah. And that's the class that you go to, and they teach you how to take blood, they teach you how to administer drugs with or to give an injection. I remember us having to do like a project, and they had the dummy there where we're supposed to learn to pull drugs, to pull blood and to give the injection. We didn't do a whole lot in it, and we didn't get to do actual practical on people. It was just the dummy doll, and they don't really take it that seriously, like because it's the nurses that teach you, and they were a lot more laid back. But it is important to know that, because if you're Jamaican and you stay over there, all of my friends that have started internship in JA after graduating have told me that the difference between Cuba and here is that doctors do all the practical work in JA, especially as an intern. You're the one pulling blood, you're the one administering drugs, you're the one doing all. So it's important that you learn these practical things, because when you come back, it's going to be like a culture shock to you, because we don't do that. All we do in Cuba, we're basically glorified secretaries. That's what I always say. Like, you're always just writing up evoluciones. That's it. The nurses do all of that. We just sit down, talk to the patient, and write up evoluciones. That's it. So, yeah, that's Enfermeria. The final subject that you do in third year first semester is Cruzo Propio. I believe that for first year, Cruzo Propio was a cancer course, so it lasted about 2 weeks. And we were learning about the different stages in cancer, the different types of cancer, whenever they metastasize, where they spread to. I think we had 2 classes or 2 conferences. And then we had, we're supposed to give in a trabajo or a final project, and then she changed it and we did exam instead. And it was literally just like a small thing where all of we in the auditorium, and she gave the questions and we were just supposed to answer them and hand them up. She walked the aisles, and basically you could cheat, but you weren't supposed to cheat. Like, she didn't want you to make it seem obvious, because like we literally had only 2 classes, and then they asked whatever. She didn't like when you made it obvious, so like she'd yell at you if you made it obvious, but like she was walking past and seeing people looking at like them phone and be like, okay, and continued. So yeah, that was Cruzo Propio. This was at my school though. I'm not saying it's gonna be like that for everybody, but I'm just being real. That's how that was. Moving on to second semester. So second semester of third year, the most important subject that you will be doing is that of Medicina interna. Medicina interna is kind of the elevated propedeutica. So propedeutica, we basically were learning the different syndromes that existed. Now in Medicina interna, it was more complex. So we were learning about cancer, you were learning about like leptospirosis, like more complex diseases, and within it you needed to know the symptoms, you needed to know the treatments, you had to know the different drugs that you needed to use to treat it. In propedeutica, we were required to learn how you could treat it. We just needed to know how to basically diagnose it. But in Medicina interna, this is everything now. So you need to know how to diagnose it, you need to know how to treat it, you need to know your plan of action basically as it relates to this patient. And the final exams reflected that. So basically they would give you a scenario and they would say, oh, this patient came in with this symptom. Let's say for leptospirosis, or no, they're not giving the symptoms. Not necessarily. It depends on however this is it. I'm gonna say leptospirosis because that's what I got for my piss in third year. Pre intersemestrial. Sorry, I'm not cussing. Leptospirosis. The patient came in for dehydration and nausea, something like that. Basically, the patient came in and they had a patient history of maybe like a week prior, a couple of days prior, they were swimming in a body of water with either dead or alive animals in it. In my case, I specifically remember that it was a case where there were animals swimming around in the water or that were in the water with them, and then the person came in for whatever sickness or whatever, and we had to diagnose what it was. The minute we saw where there were animals that were known to swim around in the water, immediately it was leptospirosis, because leptospirosis is basically when any rodent or rat defecates or urinates in a stagnant body of water, and then you as a human have a cut or any open wound, and then that water gets into that open wound and then you get infected and it's bad and everything, and you had to treat it. That's how the exam was set up. So basically it's more complex because it requires you to like have knowledge of that specific illness and be able to answer the question. So that would have been the general thing. A would have been for you to diagnose what illness that they had. 2B would have been for you to justify by saying the symptoms that were listed out, justify whatever symptoms fall under whatever diagnosis that they would have. So you have to justify why you believe that's the illness that they have in A to get the point. So A and B work hand in hand. C now, what treatment or what medication would you give them to be able to treat this illness? So if A is leptospirosis, B, you have to justify based off of the paragraph that they gave you why you believe is leptospirosis. C now, the medication that you're going to give them, I believe it was doxycycline, that you would treat them. Yeah. And then that's your whole essay question. So if you don't know it, you need to be able to identify, diagnose, and then justify why you believe that your diagnosis is right. That's important. So that's why it's more complex in internal medicine. Whereas propedeutica, it would have just been, maybe they would have given you the illness and they would have just asked, all right, what's some of the symptoms that fall under this illness? They're not asking you what you're using for treat it or anything like that. Sorry. But yeah, that was Medicina interna. The next subject, that's to me is important, anatomia pathologica. So pathology kind of. So it was basically us learning the different cells that existed. Y'all know what pathology is. If you don't know what pathology is, I encourage you to use Google. So normally that's the course where they would take you down to the morgue and you get to see dead bodies and everything. However, since it was post-COVID time, they said that the morgue was closed because it was COVID time. So we never actually got to go and see actual physical dead bodies, but they did have a slideshow with pictures of dead bodies to show us, and the different cells and the different ways that you would cultivate flesh and study to be able to study it, and how to tell like what killed them, any abnormalities in the dead tissue, things like that. So that was anatomia pathologica. It was a lot of information. It was interesting though. I will say that anatomia pathologica was interesting. Some of the things are very similar, so it was a bit tricky, and you do have midterm and final exam for anatomia pathologica. Pharmaca 2. We already talked about Pharmaca 1. Pharmaca 2, as it said, is the second part of it. So in Pharmaca 2, things were a little bit more complex. So Pharmaca 1 was basically the introduction of all these new different drugs that you've never heard of before, and it was just a lot of information. Pharmaca 2 was kind of going more in depth in these drugs that you learned in Pharmaca 1, and learning how they could be grouped together for whatever illness. So you learned a lot about diabetes in Pharmaco 2. You learned a lot about hypertension in Pharmaco 2. You learned a lot about any stomach issues in Pharmaco 2, dehydration, milk of magnesium, like if you're having stomach pain, any pain overall, like analgésicos, so painkillers, the different illnesses and what you would treat them with. So all of these different subjects that you're doing in third year, final exams, they kind of work all together in the different questions, because also in Medicina interna, some of them, it depends. There was no final exam for Lab Clinica because Lab Clinica, Pharmaco had final exam, but Lab Clinica, Pharmaco, depending in Nationality and Medicina interna, all of these things work together for Medicina interna, so internal medicine. So 4-year practical for Medicina interna, I forgot to mention that this is the first time that you're doing final exam practicals. In third year, that's when it starts. So you'll be given a patient, and you need to go and present your patient to the doctor, and then they'll ask you whatever questions, or they'll ask you in front of the patient to do an inspection of the patient, and then the doctor will ask whatever questions or whatever, depending. They might have you do it in front of the patient, or they might send you to go to the patient on your own and then come back, and then you'll be in a room with the doctor and you'll present your patient's information you're allowed to read, and then the doctor will ask you a question based off of whatever you're presented. This is the first time. It's very nerve-wracking because before all you had to do was the written, now you have to do written and practical, and it's definitely not fun the first time when you're not used to it. So good luck. So because of that, final exam, if the doctors just feel like it, they could give you a x-ray and ask you to read the x-ray and tell them what you see on the x-ray. It's unlikely that you'll get that in third year, but in fourth year when you do surgery, you definitely, my practical exam, it was literally a stack of x-rays. There was no escaping it. You had to. So even if you don't get it for third year, still learn and make sure that you're paying attention to the things that you are being taught in Nationality, because at some point it's going to come back for you. Lab Clinica was the same thing. You might do a final exam in third year, like the written, and then there might be like a table with the different values. It's unlikely, but there might be like a table with the different values. Or in your essay question, they'll be like, oh, we sent off this to check at the lab and the values came back for this, and you're supposed to know that they're irregular, and if they ask you to justificate, you could use that as part of your explanation. So basically the normal values would be this, their values came back as that, so that is in support with whatever I believe that the illness that this patient possesses is, just for example. So even though there is no final exam for Lab Clinica and Imaginalo here, sometimes they go hand in hand and put it on Medicina interna, because technically it's just other parts of, it's like supporting documents for Medicina interna, basically. Like they go together real bad. Okay, so moving on. We've done anatomy pathologica, we've done Pharmaco 2, we've done Lab Clinica, we've done Medicina interna. Another subject that you do in second semester of third year is Medicina tradicional. Medicina naturally tradicional. We had like 2 conferences for this, I remember. So 2 lectures, and then it was a trabajo final. It was, your grade was based off of assistencia and your trabajo final. There were people in my class that never got none of the conferences and just handed in a final project and they got 5. Like, so it depends on your teachers, to be honest. Some teachers care, some teachers don't. It really depends on your teacher. But yeah, this is about herbs and how they can be used, like with healing properties that they may possess, and the different treatments that you can have for them. It's kind of like surrounded around Chinese medicine, and Cuba is very big on alternative medicine as well, so it's something that you're going to do. Additionally, there was also curso propio for second semester. I don't remember if we did it and what it was. I don't remember the second one, but I know we did the cancer course. I don't remember if we ended up doing our next one. Anyways, those are all the subjects that you will end up doing for third year. I also want to add, some must-haves for third year, just to make life easier for you guys if you've made it this far. Buy these things. For third year, I'd advise for you to have a clipboard. Walk with blank pages. The clipboard doesn't have to be big. It can be like a mini clipboard. It just helps for you to like jot down any little information, because the thing is, in third year as well, which I left out, it's the first year that you're going to be doing rounds. So even when you come and you check on your patient, make sure that they're good and you write up the evolution. After, at around 9 o'clock or 9:30 thereabout, the doctor will decide to go around and do his own checking of the patients and make sure that everybody is okay. You know, if your bed has a patient, you have to stand up there and introduce your patient, present your patient basically, the way that I had mentioned it before. And then the doctor might ask like whatever. They won't necessarily ask like deep questions, but they might ask anything as it relates to like the patient. So you need to know your patient's information good. If you don't know, then you can say propedeutica, and then the doctor will ask the patient directly, and then the patient will answer them. Doctors sometimes turn that into a teaching moment, and they will give additional information that might come on like exam or just general knowledge for you to know while you're in med school. Having a mini clipboard with paper on it just to jot down those notes helps a lot. You can use your phone, but sometimes it's just nice to just have the clipboard with the paper just to jot down whatever information and look back at the end of the day. Sometimes them ask later on in the week what they said earlier in the week, so that's a must have. Blank pages to be able to add into the docket, because they're not gonna supply pages for you to write up information for your patient, and sometimes you go and the paper finish and nobody none of blank paper, so walk with blank paper. A blood pressure cuff or esphigmo. I don't remember the full word right now. I'm blanking, my Spanish is gone. Anyways, esphigmo. That's what a blood pressure cuff is called. You need that in third year. Any patient you have to take them blood pressure. Any patient you have to take their blood pressure, so you need to have that. A stethoscope, which you should have from first year anyways, but the first time you're going to be using like properly like almost every day is in third year. That and the esphigmo hand in hand, you need to have it. You don't need to have this, but I advise that you get an oximeter. You use it a lot in fourth year, so just have it from third year. That way you don't have to be holding on to people's risk to get their frequency of cardiac. You can just put the oximeter on it and it does it way faster. Last things I'd recommend, a printer if you can. The reason I'm recommending a printer is because you're going to need to print a lot of historias whenever you have nueva ingresos. The hospital does not provide it for you. I don't know if it's it. they don't. So if you can have a printer, it will probably save you money from having to go to a printing place to pay for have the historias printing, because they're like 7 pages each. And that's just one. All of those are stapled together, and that's just one. So if you can have a printer, it's best to have one, and it makes life easier in that sense. Comfortable shoes, because third year is the first year where you're standing up for literally like 2 hours straight at times, so doing rounds. And I'm not even joking. And the doctors do not like when you sit down or kneel down or anything. So if you can, comfortable shoes, that's why it's the Wallawina Crocs. And even though sometimes they won't be comfortable after a while, but comfortable shoes, because you're going to be standing up long for the first time in your entire medical career. Third year was not fun, and the doctors can shut. So you need comfortable shoes and snacks for school, because it's the first time you're going to be at school way longer than you're used to for the first 2 years, like way longer. Like you'll go to school after 8 and you not leave till sometimes all 3 o'clock, because you might have class away in the evening and you might have sala in the morning. So yeah, it's not fun. I'm just giving you tips. I hope these were all helpful. I hope you guys enjoyed this video. I'm sorry that it's so long, but anytime when I talk about what you do in first in whatever year, it's always super long because there's a lot of information that just comes off the top of my head. And I hope you guys find it useful. Thank you so much for watching. If anybody who's been through third year or is in third year now feels like I left anything out and you want to add it or drop it down in the comments below, please, I will pin it so that people can see it. Any additional tips that you guys might have. Thank you guys so much for watching. Thank you guys so much for sticking around. We're almost at 1,000 subscribers. If you're new here and you have not yet subscribed, please hit that subscribe button above and share this video with anybody that you know is about to go into third year or has any questions or whatever. And don't forget to bully them to subscribe. And I'll see you guys in the next one. Bye.